The other piece that I want to address that ties into this as we start talking about going really low carb, having, carnivore, high meat, is insulin. And a lot of people in that world demonize insulin and want to keep it as low as possible indefinitely. You have a bit of a different twist on that, where it's about controlling insulin. So let's talk about somebody over time, they've gotten metabolically healthy, but say they're on a really low carb diet, ketogenic, all the way to carnivore, and they're not occasionally spiking that insulin. Problems that can occur there.
And let's kind of first take it from a standpoint of Dr. Roger Unger, who did some of the seminal work for us to understand insulin biology, insulin physiology, and how insulin and glucagon interact with each other. So, insulin is made in the islet cells, in the beta cells in the pancreas, and glucagon is made in the alpha cells in the pancreas. And these cells are juxtaposed to each other, they are right next to each other. Now, insulin has a very specific response, which is called a phase one response. So, when you eat carbs, there are packets of insulin that are already present in an islet cell, in a beta cell of the pancreas, and these packets are immediately released into the circulation. So, there is a sudden spike in insulin. And this sudden rapid spike in insulin is one of the crucial mechanisms to the juxtaposed alpha cells for glucagon to get shut off. So when insulin is up, you would ask, why should I shut down glucagon? And that's a very important aspect because glucagon is catabolic. It's going and telling the liver to break down stored glycogen into glucose. It's going and telling the muscles to convert protein into carbs. It's going and using the glycerol from the fat to convert glycerol and did I say protein to fat? I said it wrong. It's telling protein to convert to glucose. That is what glucagon is doing. It's telling glycerol from the fat to convert to glucose. So glucagon is a catabolic hormone. Insulin is an anabolic hormone. Not only does it store fat, but it also makes the body make new protein. And it also makes new protein in the brain because the insulin spike in the brain is creating new protein, which is important for you to form new memories. I think memories in our brain are stored as protein. So it is important to understand that if you're metabolically healthy, why do you want to deplete your stored packets of insulin in your pancreas? Because over time, what happens is that if you are on a low carb diet, if you're on a carnivore diet, the pancreas says, I am not using these packets of insulin at all. Why should I make them? I don't need to make them. So the number of packets go down. So the spike in insulin goes away. The reduction in glucagon is not as pronounced. So the glucagon levels remain high. So you're remaining catabolic and you are not becoming anabolic and putting in new protein because you fail to have that rapid spike in insulin. So that's what I argue is that if you're metabolically healthy, why should an individual not periodically? And I don't know what the right answer to that is. Is it once a week? It's twice a week? It's 3 times a week? Or it is more times a week in which you should actually have that phase one, a rapid insulin spike, so that you are behaving like how our physiology was designed to behave and getting the benefit of insulin spike, reducing your glucagon, becoming anabolic, and doing many other benefits. I don't know if I explained that properly or was it too technical there, Jesse?
No, that was perfect. I want to highlight here we're talking about somebody who's metabolically healthy because insulin resistance is such a major challenge in society today. Almost everybody is suffering from it. But this is in the case where somebody's regained their metabolic health.
So when somebody is insulin resistant, they also lose the packets of stored insulin. Can you believe that? In other words, they are having to produce so much insulin to maintain homeostasis of blood sugar that they cannot maintain making those packets. So the packets are lost. One of the first manifestations of insulin resistance is the loss of that phase one spike in insulin. And when you lose that phase one spike, you don't drop your glucagon levels. And what do you think is going to happen if you don't drop your glucagon levels? You've just eaten a large meal, all kinds of protein and carbs are coming into you, and yet your pancreas is giving signals to your liver to keep making glucose. So instead of your glucose from your glucose output from your liver going down, it remains high. So the packets of insulin, the phase one insulin response is lost not just on a low carb diet, but it is also lost in insulin resistance.
Take that story even further. I want to make sure I fully understand it. So, when glucagon in that case remains elevated, you're going to be catabolic, but you're taking in calories. So, I'm picturing this massive amount of nutrition, energy in the system. What happens next?
It's metabolic mayhem because the glucagon should be shut off in order to prevent protein breakdown, in order to prevent glycogen breakdown, in order to prevent a further rise in your blood sugar. When glucagon levels remain high, the pancreas is getting signals that make more and more insulin, more and more insulin. And the increase in insulin over time, if your pancreas can keep up, is going to make you heavier and fatter and hypertensive, which means that as insulin levels go up, your blood pressure goes up, and you can get all kinds of diseases from high blood pressure. High insulin can cause atherosclerosis or plaque buildup. And so this is pure metabolic mayhem. And Dr. Roger Unger was the first one to describe the close relationship between insulin producing cells and glucagon producing cells, and how the interaction, the balance between how, as insulin is going up, how glucagon should come down is vitally important for our metabolic health. And so I find that story fascinating. He died maybe about 3 or 4 years ago, but he was an amazing icon, just like Dr. Joseph Kraft. I think Dr. Roger Unger has similarly done some very seminal work for our understanding.
And isn't it true when that's all happening and we're in this state of chaos metabolically that you have all this energy, all this insulin around, that we start storing fat viscerally? We get fat deposits in different organs, and then all the challenges that go along with that.
Absolutely correct. I missed pointing that out, but I'm glad you brought that in. So, what Jesse, you're talking about is ectopic fat deposition. At some point with insulin resistance, the fat cells become overstuffed. When they become overstuffed, they cannot take any more fat in, and those fat cells become inflamed. So, in other words, instead of just being quiescent, uh, uh, not inflamed fatty tissue, they become inflamed fatty tissue, which is bad for you. Not only do they not take in extra fat, but the extra fat that is left in the bloodstream causes the very lipotoxicity that I talk about. And this lipotoxicity is quite significant because this fat is going to get into your pancreas, destroy your pancreas, it's going to get into your liver, it's going to cause fatty liver. And at the cellular level, it causes aging. So extra fat in your cells forms toxic radicals that go and destroy your mitochondria. And one of the ways which you age is if you destroy your mitochondria, because when you destroy your mitochondria, you cannot burn fuel, you cannot use oxygen. So, lipotoxicity is potentially one of the mechanisms for aging, vascular degeneration, and organ degeneration. And that should be avoided at all costs. So, when we talk about increasing fat intake and going on a low carb, high fat diet, we are addressing metabolically healthy people. If you are metabolically not healthy, you have inflamed fat cells, you have ectopic fat deposition, you have high triglycerides. For me, the initial strategy, the way I would individualize these patients, is for them to focus more on exercise, on fasting, and a diet that is a lean, low carb diet, and rather than a high fat diet. And that is where I fundamentally am different than almost any low carb practitioner that I have come across, because I get a lot of hate mail and email when I talk about people in the beginning when they are metabolically not healthy to prioritize fasting and exercise and eat a diet that is a lean low carb diet until they become metabolically healthy and then start increasing their fat intake.
And we did talk about this last time, but I think it's important we get into it, at least in a general sense, a little bit deeper here. So what you're saying is for that first period of, I think it was about 6 months, we want
Depends
to
how
do,
young you are, how unhealthy you are, how old you are, but go ahead.
when we're metabolically unhealthy, while we're regaining that, we want to go low carb, high protein, low fat. Which again, the difference between what you're saying there versus a lot of the other practitioners is they would say go high protein, high fat. You're saying once you gain your metabolic health to a certain point, then we can bring the fat back in.
Absolutely.
So how do we know when we get to that point when we can start bringing more fat in? Because obviously everybody's coming to this at a different state of being metabolically unhealthy. How does somebody begin to clue in when they can start
Absolutely.
bringing more fat in?
And it's fairly straightforward and easy. Number one is that your triglycerides go down. Number two is that the quality of your LDL, instead of being small and dense, it becomes large and fluffy. Number three is that your HDL starts rising. Number four is that your insulin levels drop. Number five is that you have a change in your weight. Number six is that your blood pressure gets better. So there are several markers that an astute clinician can recognize and tell you what is happening to you is in the right direction, and it is point at which you can start increasing your fat intake.
If you enjoyed that clip, you're going to want to head over here and catch a full episode. I'll see you over there.
Phytosterol levels are significantly increased in people who are taking a statin. And this phytosterol is causing damage and harm that has not been properly investigated. With regards to the canola